Thank you, Anne. That was really terrific. Moving on with our theme, the forensic sciences founded on observation and experience, improved by education and research. I'm really happy to introduce Dr. Nizam Peerwani. He's going to discuss experience for us. He's the chief medical examiner of Toronto, Parker, Denton, and Johnson counties. He's a professor at Texas Wesleyan University at Fort Worth, Texas, and he was the lead pathologist investigating the deaths at the Mount Carmel, Waco, Texas disaster. Dr. Peerwani?
Thank you, Marilyn. I've been told that I have just 20 minutes. That's a lot of time, Marilyn. And she says she's a very tough lady, so I'm going to stay on time. What I'm going to talk about is experience, and I want to start by observing that throughout human history, observation has played a critical role in our understanding of the world we live in, prompting us to contemplate rational explanation of the natural phenomena we experience. It's important to understand, of course, that perception is not the same as experience, and Anne has talked a little bit about observation as it relates to perception. Perception is the organization, identification, and interpretation of sensory information in order to represent and understand the environment. All perceptions involve signals that end in the nervous system and which begin as physical stimulation of our sensory organs. How we perceive things is, however, molded and governed by our experiences. So then what then is experience? Experience is a procedural knowledge and generally refers to know-how. Perhaps one can say it's on-job training versus propositional knowledge, which is really book knowledge. There are many kinds of experiences that we talk about. Perhaps a short list would include physical, mental, emotional, social, and of course spiritual or mystical experiences that we talk as human beings. Physical experience occurs whenever an object we encounter or environment we live in changes. In other words, physical experiences relate to things that we can observe. Mental experiences are cognitive processes and involve all aspects of our intellect and consciousness. They include our thoughts, our memories, both stored as well as recent and old memories, and our imaginations. There is a lot written about emotional experiences. In fact, recent literature is full of descriptions of what emotional experiences constitute. People can quickly distinguish not only happiness from sadness, but also anger from other negative emotions such as fear and disgust. Most people seem to have no difficulty in describing and understanding their own emotional experiences or those of others. For example, if you look at that picture, one can easily say that these people are expressing emotions, they're happy, they're smiling, something good has happened to them. Now, the concept of emotional experience also appears to include the notion of empathy. Empathy is not the same as sympathy or pity. Empathy is understanding other people's experiences and projecting them on ourselves. It is a very human characteristic, so perhaps not just confined to humans, but also to some primates such as chimpanzee and dolphins. Finally, social experiences provides persons with skills and habits necessary for participating within their own societies through a plurality of shared experiences, forming norms, customs, values or normative values, traditions and social roles, symbols, and languages. In fact, social experiences play a very important role in our cognitive biases that we have talked so much in the recent decade. Then, in summary, one can say that experience is empirical knowledge and includes knowledge of or skill of something or some events gained through exposure. As acquired knowledge, experience is generally regarded as the primary source of knowledge of the world around us. According to the empiricist, we learn through perception. Knowledge without experience, with the possible exception of trivial logical truths, is thought to be generally impossible. Now, empiricism is not a brainchild of the modern world. Hippocrates, of course, universally recognized as the father of Western medicine, identified diseases by observing and recognizing clinical symptoms. Medicine, thus, from the time of Hippocrates, became an empirical science. Hippocrates was perhaps the first Western physician to employ what we now call as experience-based medicine. He observed and described signs and symptoms of diseases. He postulated that symptoms were the reactions of the body to diseases, and he introduced the method of taking medical histories. Now, his theory of causation of disease based on humoral imbalance did not, however, stand the test of time, and we have royally discarded his theory. Now, it would be incomplete if I did not also mention Galen. Galen was, of course, a Roman citizen of Greek descent. He was a great philosopher besides being a surgeon and a physician. And he was born in the eastern lands of Roman Empire in what then was Pergamum, but today I think is the modern-day city of Bergama in Turkey. The genius of Galen was to build on observation and experience with support, and that was experiments. In fact, he was the first person, as far as I know, that talked about unbridled experience. We'll talk a little bit more about that shortly. Now, the theories that Galen supported was the humoral theory of Hippocrates. The fundamental principle of life for Galen was air we breathe, or he called it pneuma, which took three forms and had three types of action. The animal spirit, centered in the brain and included control of sensory perceptions and motions. Vital spirit, centered in the heart and regulated flow of blood and body temperature. And natural spirit, which resided in the liver, which control our nutrition and metabolic processes or activities in our body. Now, as a young medical student, we were required to study history of medicine, and to us, that sounded nothing but a Mickey Mouse theory of diseases. What was unfair, of course, was that we did not recognize the genius of Galen. Galen believed that raw, unbridled experience had to be corroborated with experiments. His magnum comprised of 17 books on the use of the parts of the human body, where he described functions of organs, for instance. And he did a lot of experiments on animals, such as chimpanzee and pigs. And for example, he would tie a ureter, and he would record how the kidney would swell up, what we would call hydronephrosis these days. He would cut a nerve and cause paralysis of the muscle. So in fact, his observations and his experiences were then supported by experiments. Now, there's one other thing that I want to mention before I move on, is the book which is called Al-Qanun fil al-Tib, the Canons of Medicine. From 12th to 17th century, the Qanun served as a chief guide to medical science in the West and is said to have influenced people like Leonardo da Vinci. I'm sure that many of you know who William Osler is. He's a Canadian physician. He's thought to be the father of modern medicine, certainly in Americas. He was one of the 4 professors at Johns Hopkins Hospital as a founding professor. In his words, the Qanun has remained a medical Bible for a longer time than any other work. What Qanun described, which is amazing considering it was published in 11th century, it distinguishes mediastinitis from pleurisy, identifies the contagion nature of tuberculosis of the lung and the spread of disease by air, by water, and by soil. It gives a scientific diagnosis of hookworms. It emphasizes the importance of diet, the influence of climate and environment on health, and the surgical use of oral anesthetics. It details early signs of cancer and the importance of surgical removal of diseased tissue as soon as possible. And finally, and FDA should take note of that, Kanun recommends testing of a new drug on animals prior to general use. Now, the Kanun was written by a person called Ibn Sina, who is known to us in the West as Avicenna. He was from the town of Bukhara, which is modern-day Uzbekistan, and he traveled wide and far. He was a prolific writer and composed some nearly 270 different treatises. And his genius was that he took all the known knowledge of the time, the Greek, the Indian, the Persian, and his own experiences and experiments, and published some 270 different treatises, amongst which was his book called Kanun. All this knowledge ended up in European universities in the medieval times. Perhaps one of the greatest is the University of Padua, which is very close to the city of Venice. It is here that we know that Galileo held the chair of physics. It was here that Copernicus studied medicine and astronomy. And of course, Morgagni described many anatomical lesions in the body and is known as the father of anatomical pathology. It was Morgagni would say that the symptom that we describe in medicine is a cry of a suffering organs. Now, coming to the recent times, Newton often told the story that he was inspired to formulate his theory of gravity by watching the fall of an apple from a tree. Although some have claimed that the apple story is a myth, William Stuckley, in his manuscript published in 1752, confirms the incident. But we all know that luck favors a prepared mind. Actually, Newton was grappling with the idea of gravity for a number of years. The question was not whether gravity existed, but whether it extended so far from Earth that it could also be the force holding the moon to its orbit. By observation, experience, and experiment, Newton, after 2 decades, came up with a full-fledged theory of gravity. In more recent times, we come across David Kolb, who is a psychologist. He studied at Harvard University, and he proposed a theory of what is called experience-based learning system. He is now a professor at Case Western in Cleveland, Ohio. In the words of Kolb, knowledge results from the combination of grasping and transforming experience. Concrete experience can lead a person to reflective observation, to abstract conceptualization, and then active experimentation. And this is how knowledge is gained. There are 2 concrete components to his theory, the first and the fourth step, and 2 conceptual components, the second and the third step. It is from these processes, including observation, experience, and learning, that as forensic practitioners, we create templates in our long-term memories, which we then readily employ to reach a presumptive diagnosis. For example, if you show this particular lesion to a layperson, he really wouldn't know what this is all about. But a naive intern, having studied some forensic, would know that in fact this is a shotgun injury, and that mark that you see is a wad that has fallen off. He can describe the injury and talk about the scallop margins, the stray bullet, the pellet wounds, and he can predict in fact that this shotgun wound was fired at a distant range, perhaps 5 to 8 feet away or greater, depending upon the type of weapon and the ammunition. Or he can give a meaning to those wounds. Wound number A is consistent depending upon the history and the scene findings with hesitation cut wound in a victim of suicide, whereas wound B would be consistent with the defensive cut wound of the hand. Or the raccoon eyes that we see in a patient in the morgue are consistent with orbital roof fractures produced by a firearm injury and not because of physical assault on the person. And finally, what we see as a ecchymosis in the mastoid area behind the ear is nothing but basilar skull fracture. So in summary, although experience plays a pivotal role in empirical science, interpretation of such experience must be based on peer review and on collective experience. Unbridled subjective experience, as Galen put it so eloquently, can present challenges. Hence, today, we have migrated away from the age-old experience-based medicine as proposed by Hippocrates to experiment-based medicine. Thank you very much.